Our opponents mentioned the slippery slope issue, but really this does not matter because it is a physician's choice as to whether or not they assist in euthanasia. Also, to discredit the slippery slope issue, passive euthanasia is the same as active euthanasia in that a physician still has to do what it takes to induce death. Murphy's Medical Dictionary, 8th edition, states that passive euthanasia is the ending of life by deliberate withholding of drugs or other life-sustaining treatment. Also, the BBC.company.uk says that passive euthanasia occurs when the patient dies because the medical professional either didn't do something necessary to keep the patient alive, or when they stop doing something that is keeping the patient alive, like switching off life support, disconnecting a feeding tube, or not carrying out life-extending operation, or not giving life-extending drugs. It's almost the same as active, except that the patient would suffer more. The patient wouldn't die right away like with active euthanasia. It would take longer, and they would simply suffer more. Our solvency was that legally assisted suicide would stop all these problems. And in the case of Sue Rodriguez that my partner talked about earlier, where she was dying slowly of Lou Gehrig's disease, and she begged the courts for euthanasia. If assisted suicide were legalized, people like Sue would simply have the right to choose euthanasia, rather than be begging courts and trying to fight the law and frankly living in fear of a painful death. From the Journal of the Mental Health Series, A Patient's Right to Die, says that there are terminally ill patients whose pain cannot be effectively relieved. As I said before, if assisted suicide were legalized, these terminally ill patients with the unrelieving pain would no longer have to worry. From the same journal, says that terminally ill patients believe that they will lose their dignity and integrity if they have to live out their remaining days unconscious in order to obtain relief from their insufferable pain. So, if we legalized assisted suicide, these terminally ill patients could remain with their dignity when they chose to pass on. According to the writer of an article on ethicalrights.com, voluntary euthanasia means that a person who feels that their life is not worth living because of intractable pain and or loss of dignity and or loss of capability should have the option of requesting assistance in dying. If assisted suicide was legalized, this right would be granted. Lastly, from the Journal Mental Health Series, A Patient's Right to Die, it said that for some suffering a terminal illness, there may come a time when further treatment brings only agony and when the quality of a well-lived life slips away. So, like my partner said before, in order to obtain a quality of life, the terminally ill patient should have the right to choose when to die. According to Oregon Public Health Division, on October 27, 1997, Oregon enacted the Death with Dignity Act, which allows terminally ill Oregonians to end their lives through the voluntary self-administration of lethal medications expressly prescribed by a physician for that purpose. Our opponent said that Oregon wasn't doing well in the medical department, but right here, said by Brad Knickerbocker, writer for Christian Science Monitor, says that Oregon ranks among the best in the nation in end-of-life care. This means more people are looked after at home with the emotional and spiritual support of their families rather than spending their last days in the hospital. So, in order for terminally ill patients to regain their dignity and quality of life, active euthanasia should be legalized.